we're going to talk about management of calf scours, and pay close attention to some highlight on this slide. We'll come back at the end and you'll see why it's important. So as Dana said, I was born in Minnesota, but I actually moved to Michigan when I was only 2 weeks old and moved back to Minnesota to finish, to be closer to family. And I went to undergrad here in Minnesota, but went for 4 years of warmth in Missouri and couldn't stand the heat. So I came back to Minnesota, where I have worked doing all large animals since then. Up until May of 2020, I took a job with USDA, and that is where I currently do the bulk of my time, keeping a small group of clients to keep me busy on the weekend. So for those of you that were at the session in March of last year in Carleton County talking with the Soil and Water Conservation District, a lot of this is going to sound pretty familiar, so I apologize for the repeat, but it gets into the same topics. And I participated in August as the webinar series in August as well. Unfortunately, or not unfortunately, very fortunately, life has gotten a little busier since August, so I have not been able to listen to the webinars this time around. So if I say anything contradictory to what you've heard earlier, I'd be happy to have a conversation about it as we go through. And if anyone wants to, bring that up, I'd be happy to talk about it more. But this is based on my information, my experience. So this is my giant disclaimer that I made up. I may be a veterinarian with USDA currently. That is my full-time job, but what I'm presenting tonight is based on my educational and professional work experience. What I say tonight is not USDA opinion, not USDA policy, and is just the thoughts in my little brain. So take what I say with a grain of salt, but I hope you find it useful. So I'd like to begin anytime we're talking about a disease problem, which scours would be a disease. I like to start thinking about the diagnosis. And there are a lot of different diagnostics we can do. When I was in Foley, we would do simple fecal floats, spinning down a tube with manure in it, seeing what eggs were present. We would do direct smears, looking to see what was there, looking for the different pathogens. After about the 10th one, I had a coworker that we started to, she said, well, you can do it by age. And that has held true. What I've seen, what others have seen and experienced, and it gets the job done as far as diagnostics without spending a lot of money. So the quick and dirty way that I like to think of it is in the first 7 days of the first week of life, it's usually bacterial. E. coli is the one I think of. In the second week of life, I think of the viruses, either rotavirus or coronavirus. No, not COVID-19, the cattle adapted coronavirus. In the third week into the third week, I think of cryptosporidium, which we need to caution everyone that is a zoonotic agent. There are people that have gotten it from calves and gotten quite sick themselves, spent the weekend drinking a steady diet of Gatorade just to keep themselves hydrated. So kind of know what a calf is going through. And then in my head, I don't think of coccidia. I know this was one of the starting questions. I don't think of coccidia really setting in until that third week of life. I've seen cases where it's been earlier, but those are usually really heavy parasite loads in that property or premise to have enough of the agent to actually overtake the normal gut flora and population and cause that diarrhea out the backside. So I see outside there was a whole host of answers. I don't see the poll anymore, but I normally don't think of it until the third week or after 3 weeks into 4 weeks. And that can actually persist as a problem even out into, I saw it a few years ago in fall calves or spring calves in fall on pasture. So that's where I start with the diagnosis. Once we have the problem diagnosed, I like to move on to treatment. So in general, scours is not an antibiotic deficiency. If you look back at those agents, the bacteria in the first week of life are about the only things that would be sensitive to antibiotics. And for the most part, for those first weeks of life, so the viruses, crypto, and with even E. coli, if we can keep the calf, probably 1 second. Buddy, can you go back to your room? Oh. Ah. All right, I apologize. 4-year-old needed some books to read before he actually falls asleep. So, so getting back to it, scours I don't see as an antibiotic deficiency. So I don't think we need to be putting antibiotics into every calf that starts having some scours or, you know, a little bit of loose stools coming out the backside. The majority, the E. coli, the viruses, and even crypto, if we can keep those calves hydrated and keep replacing what's getting lost, they can generally make it through on their own. So especially in the beef world, that gets a little, you know, a little dicey, but as long as they can be up and nursing on mom, they a lot of times can get through on their own and just give their bodies time to work on those agents that are causing the disease, and they can overcome them on their own. We can do IV fluid therapy, and having worked in Foley, we did a whole lot more dairy work, and I have IV'd lots and lots of calves when you don't have the benefit of having a beef cow that's always ready to feed those calves. So it's a possibility, but that gets to be an expensive bill pretty quick. And if it's something you're looking to learn how to do yourself, once you've done it a few times, it's a fairly easy process to give IV fluid to calves. But that's something to work with a veterinarian in the context of a valid veterinary client-patient relationship, where they've given you that instruction and they're telling you how to mix those fluids. That's a little more than we really need to get into tonight. I'm not here to make you guys acid-base experts by any means to know how to do it, but looking to address the common problems as best we can. So getting into that the older causes of scours or diarrhea in older calves is the agent in coccidia or coccidiosis. Sulfa or amprolium are the two drugs that are labeled and come to mind for treatment. Depending on your state, I think sulfa is a prescription product in some states. Amprolium, for the most part, is an over-the-counter product, and that disrupts that coccidia life cycle. And my general rule of thumb is that if one animal in the pasture has it or in the group has it, the whole group probably needs treatment and would benefit from it. There are regimens where you can do a treatment dose and a preventive dose. Those are obviously different amounts of the active ingredient getting into the animal, but that is the only one that I really see a strong case to push for treatment on, short of keeping the calves up and nursing and intervening as you need to. So maybe that's adding a bottle, an extra electrolyte feeding in the middle of the day, just with a commercially available electrolyte. But a lot of times if we can keep them up and nursing, they'll take care of it on their own and just have to get them through that rough patch. So prevention to me gets the gold star. This is where we manage our scours, is in preventing it. So the first thing I like to see is that the cows are in a clean calving area. They aren't calving in a mud pit. When that calf comes out and it tries to take its first breath, we want that to be oxygen and air, not the filth that it got dumped into. And along those lines, we like the cows to be clean. If the cows have clean udders, the calves aren't sucking off the last year's worth of mud from their older siblings, they're going to have a lot better uptake of that high quality colostrum that we get from the cow. So in the first 12 to 24 hours of life, the big molecules that are antibodies that pass the immunity from the cow to the calf, those have to go through pretty big openings. And oddly enough, bacteria can go through those same openings if that calf is eating literal crap as its first meals. So we want the cow to be clean. We want the calf to be coming out in a clean environment. We want the calf up and nursing, ideally right away, within the first hour or two. And we want that calf vigorously nursing on that cow. That's going to get that good set of antibodies into that calf that builds its immune system for the start of its life. That the area we can control in that is making sure that cows are in adequate nutrition, in adequate body condition. And now it's getting a little late in the year. If you're calving in the next couple months, it's going to be really hard to put on a lot of weight. The calf has a big demand on that cow, and it's getting into the harder parts of the year. So that needs to be managed throughout the year, that the cows are in a good plan of nutrition, eating a good diet, so that they can make a high quality colostrum that's ready for the calf when it hits the ground and it's ready to suck. Beyond that, I'd say clean pens, but this can come to a broader issue across the whole farm. And realistically looking, how many cows can your facility support? Can you realistically put a cow, one cow per half acre? I'd wager probably not. You may need to push that up, and it's going to be dependent. I mean, the northeast corner of the state up by me in Duluth compared to the southwest corner of the state is drastically different, which is drastically different than the northwest corner by Crookston, where I went to school for undergrad. So you need to know what your facility can realistically take. And that may be a harsh conversation or a harsh realization that what you have may not support the high size herd you need. But we need to make sure that cows are thriving in your environment and not just barely getting by. And seeing that manifest every year as calf scours. The other thing that I like to preach for control is your calving season. You can absolutely control when you put those bulls in, when you AI. And calving right now is getting pretty sloppy. Calving 2 weeks ago was pretty dang cold. But if you give me 3 months, it's going to be a heck of a lot nicer. Calves are going to be hitting, instead of potentially falling into, slop, wet, freezing ice, they're falling on starting to grow green grass. So that might be something where if we push the calving season out to May and June, the line one of the people that taught us in vet school had said was, if you aren't doing this as your profession, where you aren't professionally raising calves, it's your sole source of income, you can get by having those calves hit the ground in May and June. You may not wean the biggest calves in the area as compared to the guys who are calving in January, February, and March. But if you can wean more calves, as in you aren't losing them because of scours, because of failure of passive transfer, because they ate just crap colostrum when they are born, you're going to be doing a lot better weaning a higher percentage of calves that survive through the scours event because they hit in a non-sloppy season and started off with a good life, a good start to life. And the other comment there, the 60 versus 90 versus 120 is I will say, personal pet peeve. When in Missouri, they say you have a Missouri calving season, which is 12 months. I think we need to be pushing for, realistically, I'd really like to see 60-day calving intervals. The bull goes in, he has 60 days to work, and he's done. And cows that can't get it in that time, I'm sorry, I wouldn't have many cattle left, but they'd go down the road. So that's something I like to push my clients to do, is to minimize those cows that get strung out and hang on late into the season. Because if you have a calf that, say your first calf is born next week on March 1st, and you aren't done calving for 120 days, and your last calf is born on July 1st, that their older cousins are just spreading tons of manure. So that calf that was born March 1st is going to be spreading some of those. It's going to be spreading some bacteria like E. coli. It's going to be spreading rotavirus, coronavirus, crypto, and coccidia. It normally can be coming through their digestive tract, and as calves get older, they can handle it. But when you have baby calves hitting the ground and they have 4-month-old herd mates, they've got a whole lot more to deal with as far as a pathogen load. So I would really like to emphasize having a shorter calving season. It means you aren't working, you're working hard in that short time frame, but you aren't getting strung out as far. You keep your pens clean for that. Oh, pardon me, wrong click. You keep your pens clean for that shorter time. Your cows are able to stay clean because you're controlling how long you're in slop for, and you're coming into a clean calving area. So I think it really sets you up for success in all of these areas that we know can minimize how much we see of scours as the calves grow up. So on the lines of stocking density, one of the protocols and one of the poll questions was about the Sandhills calving system. So the goal of the Sandhills calving system is we move cows that haven't calved onto a clean pasture, and we maintain a clean environment as possible for calving and for the newborn calves to go. And with that, you avoid the stress. This is me, and you avoid the stress and contamination of older cousins. So I apologize to my cousin Vicky, but we want our calves to not be irritated by their cousins as they're growing up and getting a start in life. So I'll kind of walk through the process of the Sandhills calving system. And Joe had sent me some slides where he has a whole lot better illustration, but I like my smiley faces that I made. So bear with me. So you start out, and all the calves, all the cows, so the bigger smiley faces are in one area. And for the first calf, you have your first calf for the first 2 weeks. Those moms, they get to stay there. And this clean pasture is where your cows go that hadn't calved yet. Magically, Mrs. Yellow spits out a calf, or that cluster of calves. They stay there. and we move around the circle so that the oldest calves are still staying here, and they may be exposed to these pathogens, but they're old enough to deal with them. But these younger calves are being born into a clean environment, so they're getting a good start, and they aren't having to deal with the filth that their older cousins have passed along. So we keep that process going. So now we're at, if you see here, you go about 2 weeks in each area. So now we're at 5 to 6.5 weeks, and then you're out to 6.5 weeks to 8 weeks. The last of the purple calves fall in this pen, and you're at 8 weeks, which conveniently for what I said earlier, puts you at about 60 days of a breeding season. So just with 5 pens, you're able to spread out that manure load, minimize the amount of pathogens that those calves are seeing when they hit the ground, and hopefully decrease your risk of scours. And you have a tight calving interval where you're going to be weaning a nice, consistent set of calves that hopefully will bring a better price when you take them to town or however you choose to market. So that's a Sandhills calving system in a very simplified, smiley faced handmade diagram on PowerPoint. The other system is, I've taken this from a veterinarian I had worked with and interacted with when I was in undergrad, and I don't know that there's an official name for it. It's just what worked really well for him. The downfall is, and this was brought up last year when I showed this, is that how do you do this now? And you can't do it right now. So I apologize, but it's an idea to use in the future, and you can use some of the concepts as you're making your plans going forward. So it does require, like I said, advanced planning, and you need to have infrastructure because the watering gets to be a challenge. But in the fall, as you're making, and in the summer, you can do it too, as you're making bales, you put the bales where the cows are going to go in the winter, as opposed to trying to fire up your tractor every day. And when it's -30, you're trying to get your tractor started. You're just moving the cow and moving the herd onto a different area and dispersing the manure. So, and you can achieve the same thing when you look at changing where you roll out your hay. If you're bringing out bales on a daily or weekly or however frequently you have to do it basis, you're trying to spread manure around so that it's not concentrated in one area, not concentrating those pathogens that when the calves are born, they're hitting into a scour, a minefield of scour pathogens. So now we have black cows. I have a dog named Angus, so we'll say they're black Angus cows, and these are all sets of hay bales. So what this producer and veterinarian had done was he set his bales in areas where he could put in fences, and then rather than trying to get his tractor fired up and move bales around, he has an outside job, so getting feeding done is a challenge sometimes. So he would set himself up for success in the fall and have all of his bales lined out seemingly randomly across his whole field or his whole pasture area. And as the cows ate this first set of hay and it turned into a minefield of scour pathogens, or they started to trash the ground, they would move into the next section and you would just open up the fence and move them over. And you continue doing that as you go through the winter and even into the spring, so that you're spreading out that manure and keeping that ground from being as dangerous for those calves when they're born. So just another option and something that can hopefully trigger some thoughts on what might work on your farm that I've seen work for other people. So that's just some of the ideas that I've seen work, and hopefully it gives you that idea that we want to spread everything out so we aren't putting calves in a big area that's just full of pathogens. So additional fixes, I could not. Troy asked me to stay under 40 minutes. I don't think I could take 40 minutes and give you a decent background of all the different products we have for scours. So there are a lot of good products on the market that sometimes are needed. I mean, I recommend some products for my clients. It's not good, it's not bad, it's just what they need to do to make their system work. So we can look at, there are vaccines, oral vaccines that you give to calves on day 1 for protection against some of the viruses. There are egg-based products where they hyperimmunize chickens to the different pathogens, and then you feed that to the calf so that you can pass along that passive immunity to cover them and when they're exposed. There are some pills that have the same principle. They're providing immunity for those calves, and there are also vaccines for cows. So I mean, again, that's going to go back to having a well-fed, adequate body condition and adequate facilities to get those vaccines into the cows to make a good colostrum that you're passing on to those calves. So those are all things that you can work with your veterinarian. And I don't want this series to turn into, we don't need our veterinarian, because we heard Joe and Tony talking through this. I think you absolutely need to have a veterinarian in place that you can talk with the veterinarian so you can know what the problems are. Because if I have someone that says, yeah, the calves they calve into that lot and it's always so filthy, well, I need some scour vaccines. I'm probably going to have a conversation along the lines of, maybe we should not be calving into the mud. I mean, I'm happy to make some money off selling you vaccines, but I'm much happier to have you have healthy calves and you aren't fighting every year. So I encourage you to work with your veterinarian, your extension agents, as much as you can. Utilize those resources. The solution isn't always at the end of a needle. And odd for a veterinarian to say it, but I think we push too much for the end of a needle being the solution. And like I said, you can have a vet place a catheter. That's a really good solution for a dehydrated calf, but it doesn't solve the problem. So there are a lot of other resources. Dr. Joe had I think 3-part series on scours on the Moose Room podcast. I really like the guys at Kansas State University. They have a BCI Cattle Chat podcast that is very beef focused. They barely ever touch on dairy. But just so you guys know, there are some podcasts out there. If you like, this summer as you're sitting in the tractor, I have a lot of road time. I go through podcasts like crazy. So I think those are 2 good ones to use. And then if you would like a link, I can try to make these slides available. The Sandhills calving system was made and kind of initiated at the University of Nebraska in the Sandhills. So they're by far much more expert at it than I am, but hopefully you got the concept with it tonight. So with that, hope you enjoyed management of scours. And you see now that circle, that underline has turned into the management is the key. And if we can address our management, we can hopefully avoid scours and get our calves through it. So with that, what questions can I answer?
Hey, I've got one, Dr. Tony, it was sent to me. Can you describe the calf scour tubes that you can pick up from a store or your vet clinic? What are those? I'm thinking they're asking, what are those treating or what?
Yeah, the ones I'm most familiar with, and again, this was more focused on the dairy side where you're handling every calf. We used to use a lot of Epic Calf Newborn, and that's one of like the egg-based proteins where they take chickens and they vaccinate them for rota, for corona, for E. coli. I think they can vaccinate them for crypto as well. And then, so those chickens are making the antibodies in their eggs. Then those eggs are dried and made into a cracked, dried, made into a little paste. And that's what you push in that calf's mouth. So you're just giving that calf antibodies that a chicken made. I think that's what most of those tubes are. At least that's what I'm familiar with. I think Joe's on. I don't know if you know of any other ones, Joe, that would be in the tube.
No, I think that's most of them. The only other thing I think about are, that's all of them for the most part. Probiotics are out there as well. I think that's something that people give in a paste in a tube as well. Again, I keep going back to what Tony said. It's all about management, and hopefully you're doing all those things well enough that those things aren't super necessary. But for some situations they are. That's something you work with your veterinarian to figure out if that's something you need to spend money on or not.
Thank you. Next question. How long can rotavirus live in dirt lots, and what is the best vaccine for calves to prevent it?
Oh, I do not know how long it can live in a dirt lot. I definitely think it can compound, where if you've been calving in the same spot for the last 30 years, I'd wager there's some rotavirus in there from the year before. I don't know off the top of my head how long it can live for. The best vaccine, one that works, it has to work in your system. I haven't done a lot of research comparing the kind of 3 big companies, what they have out there for a vaccine. If you have a preference one way or another, I'm not going to tell you it's wrong. I don't know. Joe, do you know, have you seen any research which one is comparably better?
I don't like to get into that. I like to leave that to a conversation you should have with your own veterinarian. I have my personal opinions. I agreed. Rotavirus can usually, I think of rotavirus, especially in an environment that it likes, out of the sun, usually you're talking about a month it can live in that pasture. Yeah, it can live a long time, especially when you talk about rotavirus, corona, and crypto. Crypto especially. Crypto is incredibly hardy, and really, there's only a few products that will actually kill crypto. If you're using bleach and power washing and things like that, you're just pushing it around. You're not actually getting rid of it. So the only thing that helps is time and sunlight. So keep that in mind. As far as the vaccines, I don't really want to get into it. Talk to your veterinarian about it. There's some research and clear data on two of them that I think are better than the third.
There was a question that came in the chat. Do you recommend a paste at birth? And if so, what?
I recommend colostrum at birth, high quality colostrum.
Yeah, that's all I have to say as well.
I got a question here. Is rehydration by IV a better way than oral? Does it cause less gut distress?
I guess I could make a case where it might cause less gut distress, but if you're at the point where you have to IV a calf to make it live, I mean, I had a dairy client that I kid you not, I put IVs in 3 to 4 calves a day. And it got old. I mean, I got to the point where I could feel these dehydrated calves. You could feel this like 18 gauge catheter barely pop into a vein. Think, oh gosh, I have really good feeling skills. It's like, I shouldn't get to that point. So if you need to IV that many calves, I think you're kind of behind the 8 ball. I think you can do there is some work. I think if you IV them and do some oral rehydration, I think that helps more than just throwing some fluids in their vein, because odds are they're probably just going to crap that out too.
Yeah, the research is there for, especially once the calf is down, to do both, regardless of if you IV or, if they're down, they need an IV. But there is research to show that they should also get oral fluids as well. My usually if they can stand and they're doing that on their own, and they still have a suckle reflex, then I'm pretty confident that oral rehydration will help them enough. I usually, that comes with a caveat of just doing it once isn't going to get it done a lot of times. You need to be doing it with the dairy calf. We talk about splitting the feedings and going once, but for a very mild case, but we're talking probably 2, 3, 4 times to really get caught up sometimes with our oral fluids. And with beef calves, yeah, I mean, sometimes you're bringing them up close, so because you're going to be doing it more than once a lot of times if you've already noticed that they're slow or they're scouring or doing those kind of things.
Another question from the chat. What is your opinion about rotational grazing, and the whole group herd keeps moving to clean pastures throughout calving?
It's kind of getting at the concept of the Sandhills calving system, but the goal with the Sandhills calving system is that you're leaving those older calves behind, because those older calves are also going to be shedding all those pathogens, and I would wager they're probably even spreading it more than the cows are. So it gets the idea of it, but you kind of have to get rid of those older cousins that are just making the whole situation worse. So not a big fan. It kind of defeats the purpose of the Sandhills system.
Yeah, and I think the one other system that we didn't talk about is having a calving lot that that cows don't have access to any other time of the year. And if that calving lot and or pasture is big enough, it seems like a big investment up front, but when you stop losing calves, it pays for itself pretty quickly to have a designated area that you only use for calving. And of course, that comes with all the caveats of having adequate bunk space, adequate water, probably a lot of concrete to manage mud and all that kind of stuff.
Along with that, we'll ask this question quick, because it kind of goes with that. A follow-up in the Sandhills system. At what age do you put them all back together then?
I think and like I said, the folks in Nebraska have it ironed out a whole lot tighter. I think you can really start putting them back together as the calves hit 4 months of age. You can almost like backfill it. So those, like the first calves that are 4 months old can join the other ones when they're 4 weeks old, not 4 months old. That'd be a long time to eat at pasture. So 4 weeks is my general kind of idea on it. That gets you past the big time for all of our pathogens. So that's kind of the rough idea I use.
Do you need vaccination if the calving area is sufficiently clean?
I mean, if you go back 200 years, we didn't have vaccines, and somehow calves lived when you had a whole wide pasture that they were calving on. So my blanket recommendation for my beef clients, I do not include a Scours vaccine.
Yeah, I would agree that, I don't usually include it. I think it all comes down to a lot of other things that we didn't really have time to talk about tonight, where it comes down to overall health of the dam, bunk space, body condition. Those things are going to help your colostrum quantity and quality more than anything. And so proper nutrition management, thinking about the pathogens. I've started to think about Scours vaccines as more of a tool to help us through management challenges as we fix the underlying cause. So in the ideal world, no, you don't need them, but you have to do a lot of other things right to get rid of them.
I got one here quick. What first shots would you recommend for newborn calves to prevent some of these other diseases that they could possibly be exposed to as they get older?
Big shot of colostrum. Like I said, I think this is my broader opinion of the beef industry. I think we started to turn looking for the answer at the end of a needle and syringe way too much.
Absolutely. I'm totally on board with that. Focus, put your money and time into all the other things that matter more than vaccines. And that colostrum being way at the top of that list. And that comes down to, again, dam health and nutrition, bunk space in the pen, managing this pathogen and the flow of animals. That's always going to be more important than a vaccine.
Okay. I got one here. We have had good luck with good quality beer and probiotics to get the gut going again after moderate scours. Has anyone else tried this, or are there drawbacks that we are not aware of? The probiotics used, or if I get this right, probias?
Yeah, so I've not looked at anything with beer. You do have to get a little bit careful. Some of the probiotic products out there are designed for a cow, and a cow is not using their stomach like you and I have, a simple stomach. Calves are still on that simple stomach, so your probiotic needs to match the digestion system. We can't give a cow probiotic to a calf and expect that stomach is going to work the same way. So I think if I remember right, and I haven't looked in a couple of years, Probios is one that actually did match that pretty well if you're getting the calf specific one. Yeah, no clue on the beer. I like beer, but I'm not sure how it fits for restarting the gut.
Yeah, the theory is that you're giving some kind of carbohydrate and potentially some yeast, but it's much better to just use, like Tony said, something that's targeted for that calf.
Another question from the chat. Are the gelling electrolytes better? Oh, we moved to slow rate of passage to increase absorption?
Like a gel electrolyte, like a little, like the tube, you think?
Mm-hmm.
I don't know that it makes a huge difference. The point is that they're getting into them. The body is going to naturally pass those through anyway. I guess I lean towards the pouches that you mix up, because then you know that calf is drinking and getting water into them as well, not just the gel. But it comes down to the electrolyte content of it.
What is recommended for navel dip? 7%, 1%, or 2%?
I know iodine was hard to come by for a while, and it started to drop down, and then some of the alcohols came out, and chlorhexidine. I think there's a variety of solutions. I grew up at the dairy in Crookston. We did 7% iodine, and that's what I got used to. So that's what I kind of fall to. But I think any of them are doing the job of drying the navel is the goal.
opinions on adding Rumensen in feed or versus vaccinating for scours?
I think you're kind of, I don't know. To me, that's getting at two different time frames of life. So, I mean, Rumensen would be a coccidiostat, slowing that down in an older group of animals. I don't think you can reliably get Rumensen into a suckling beef calf.
Okay. Gosh, it's getting a lot of questions here. I apologize. It keeps bouncing around. How do you avoid warts in the herd?
Warts?
Warts. Yep.
Don't get them in the first place. It's a virus. Typically, it's a papilloma virus, and it's just a matter of getting the cattle to respond to it. But once they're in, I don't know of a way around it. There are autogenous vaccines where you take warts from your farm, they mash them up, they make a vaccine, and they seem to work just about as well as any old wives' tale. I don't know.
Sunlight seems to work just as good as anything else, and time. I don't know if it's a show animal question, then that becomes different. But in a commercial herd, it doesn't bother me. They don't bother the cattle. They don't bother production. So I don't worry about them personally in a commercial herd. That's my opinion, I guess.
The only thing I've noted on doing breeding soundness exams in the spring, and this is really anecdotal, it seems like herds where I see a lot of warts in, the yearling heifers, I see more warts on penises of the bulls. So that'd be a good reason to keep it out. But I don't have a great solution for getting rid of them. They just sucks.
With that, we got a couple questions on why does ringworm show up every year?
Because it's everywhere. So another anecdotal story, we had what's now demolished in Crookston at the research station. We would move calves out of the dairy barn into a really short old sheep barn. They would do fine. They'd go to an old pen that only faced, I think it faced northeast, which if you've ever been to Crookston, the sun doesn't shine that much anyway. And if you're facing northeast, you never see it. And as soon as those heifers hit that barn, like their whole face just became ringworm. And it was in the wood, it's everywhere. So if you've got it at your farm, it's everywhere, and they get exposed to it, they can't fight it off.
Another question, any opinions on the osmolarity of the electrolytes? Stay around 500?
Oh, I have not looked at the fluid therapy recently enough. Joe, I'm going to 100% say I don't know that one. Do you know off the top of your head?
Electrolytes, what we want to avoid anything above 600. So 600, that's what we want to avoid. The big thing is that with most electrolytes, they're going to be made to be that way already, but you have to mix them correctly. If you mix them according to the package directions, then you're usually safe. My favorite that we used in practice was hydrolyte. That's actually one that is on the edge. I mean, it can be close. It's like right around 600, maybe even 650. So if you have any doubt, just mix it more dilute. But you really want to avoid getting too high, because then you can make it worse. You can cause an osmotic diarrhea, and you're making the scours worse. You're actually not hydrating that calf anymore. So yeah, you want to mix everything according to package directions. I recommend mixing the whole volume of the packet. Even if you don't think you're going to use it all, put half of it in the fridge if you're not going to use it. But you really don't want to mix it too heavy, because you can do the same thing with milk replacer. It's just not good. So yeah, stay below 600. 500 is a good goal.
Okay. How about a buffer in the electrolyte?
So electrolytes are kind of designed to do that already. I don't put a buffer in my electrolytes. I think, again, you're messing with the osmolality, and you don't know what you're doing with that. I tend to put a buffer in my IVs, and that's something you should talk with your veterinarian to see if that's something that's right for you, or if it's something you can do. It does help, because we are fighting an acid-base balance difference. But again, like Tony said, that's a whole hour lecture to try to figure out how to get our heads wrapped around that. And I probably couldn't do it off the top of my head, to be honest.
And I guess if they're asking, I'll kind of piggyback off what Joe said. With if you're using a packet, like if they're asking for oral electrolytes, just follow the packet directions. Like there are people smarter than I will ever be working for these multi-billion-dollar companies that make up these recipes. They probably got it.
Okay, thank you. Danny and I are just doing one quick glance through the chat box, and
I've got a
oh,
couple that came directly to me.
Okay.
One of the things that, well, and I think Stacy was asking about, are people asking about resorb versus other electrolytes? I have a personal opinion about resorb, and I'm not afraid to share it. I do not like resorb, mostly because on the package or on the container, it says to withhold milk while you're giving the resorb, and that is absolutely 100% incorrect. You cannot take away the calories from these calves. You cannot stop feeding them milk. They need that energy to fight off this infection, and they need that hydration. They need the water in that milk to stay hydrated. So you cannot take away milk. So I am not a fan of resorb in any way, and I don't believe in it. That's a big piece of it, but I would rather see you get big amounts of fluids in these calves, and that's going to save a calf more than anything. Okay, so did we just get another one?
I think somebody dinged. I heard it.
Somebody said they didn't like resorb either.
Okay, perfect.
So,
Yeah, that's my piece on that. Okay, so I got a couple in the chat directly to me, and Tony can definitely comment on these too. Just a basic opinion on what about our new products that we had just come out, competitor to Enforce Nasalgen 3. So in my opinion, when these companies come out with a lot of these different vaccines, and I see it with all the different companies, it's very rare that a vaccine is significantly worse than a competitor's vaccine of the same type. It's very, very rare. It does happen, and there's pieces of each vaccine that I prefer maybe over one or the other. But when it comes down to this battle between Enforce and Nasalgen 3, just get whatever one you can get cheaper, to be honest. Whichever one is less expensive, grab it. That's the one that I go with. There's not enough difference, and there's not enough difference in the research to tell me that they're all that different. I prefer, if you're going to do something like that, try to stick with the same one throughout the process. If you do have a problem, but you've been mixing companies, it's really, really difficult to go back to them and say, what can you do for me if I've mixed the companies throughout the whole time? So I prefer to do that. Just pick one. Honestly, don't see a big difference. Tony, any opinion on that one?
With Nasalgen being newer to the market, I freely admit I am not keeping up as much on new products, but I really like intranasal vaccines. Like I'll just throw that out there. If you like one or the other, sure. I mean, one's pretty in blue, I believe. So if you really like blue, that may be your style, but I don't have a preference one way or another, but I like intranasals.
The next question was from, I think kind of the last talk, 2 talks ago. It was a preference on OB lube. The question was, do you prefer general OB lube or septic OB lube? I think the big thing that's happened in the lube market, which just sounds ridiculous to say, is people have been adding colors to lubes to kind of give the impression that they're a septic lube when they are not. Okay. Most of the lubes are going to be septic. Like they don't have added bacteria. They've been pasteurized and or some way, the way they were developed, they don't contain a lot of bacteria to begin with. But some products contain a blue food coloring dye or whatever it is to make you think that it has Chlorhex in it or something like that, when it actually doesn't. So when it says septic lube, just kind of make sure you read the label, make sure that is there Chlorhex in there or not? Is there anything added that would actually make it a disinfectant as well? Oftentimes the answer is no. So lube itself is just more important than anything when you're dealing with a calving. Like you just need lube. I don't care. I honestly don't really care a whole lot what it is. I prefer it's a lube designed for obstetrics. I really would. with the exception, like we talked about, Vaseline in some cases on the pole of the head, on the backs of your hands, so you don't get squished into the pelvis so much. But that's, I just get lube is the most important piece. I don't really care which one you use, to be honest.
Can you guys share, how do you feel about the nasal gen 3 with Pastorella?
The data is not quite out there yet in big numbers for me to know. The original design of that vaccine actually had Pastorella and Mannheimia in it, and that was a long time ago. I mean, we're talking, I think, late 80s that we actually developed that vaccine, but the original one had BVD in it as well, and that caused a complete immune freak out and overrided everything, and that's why it didn't really go to market. So there is some data to show that it is beneficial. Again, I'm not quite sure we have enough information to know how beneficial adding that bacterial component is, especially with all the new information coming out about Mannheimia hemolytica and Pastorella multocida being just standard bacterial flora in the upper respiratory tract. So we don't really know what it's doing for us yet. I think that there probably will be some benefit. I don't know if it's going to be in young calves. It might be a little later in life. We'll see.
And I'd throw that same caveat on my previous statement of I really like intranasals. If you're spraying out, if you go to your neighbor and you spraying out Pastorella all over you, why do I need to pay for it to put it in a syringe? That's going in your nose. So that's the caveat. And like Joe said, I think there's more research coming down the pipe, but I like just the viruses in there.
Okay. Another question. How soon after the calf is born would you recommend giving a bolus pill?
Bolus of what?
I'm not sure.
If it's a bolus of colostrum, I'd recommend within the first 4 hours, and it should be a high quality colostrum.
Scours.
There you go. No, I totally agree. The pills themselves, again, I think that's the products that Tony was talking about, where we're just giving a giant dose of antibodies. If you read the label on a lot of those kind of things, well, yeah, I guess it depends. Like if you read the label on Calf Guard, for instance, which is an actual vaccine for rotacoronavirus, it says that you need to get it in before colostrum and 45 minutes apart from colostrum, which it's almost impossible, to be honest, in a beef situation for sure. So to me, again, it comes back to if you have to give the pill, whenever is fine. But focus on the other things that matter more. Potentially save that money and spend it on something else that matters more, in my opinion, which would be fence, so you can work on cattle flow, or more bunk space, so you can get that 2 feet per head to really prevent body condition being all over the place in your herd and make it more uniform. Save it over a couple of years and drill a new well, get more water. All those things are going to matter way more than what you give at birth there.
The one thing to be careful with, I think you can see an interaction if you give Calf Guard, and I think First Defense is the one where you can get a problem where you're basically trying to give antibodies and you're giving the virus. So you're kind of canceling each other out. So just be careful if you're double dipping. That's more of a dairy issue, it seems like, but just keep that in mind.
I think, Dana, I think we're out of questions again, or do you have any more sent directly to you, Dr. Joe? Okay. All right. Thank you very much, Dr. Tony.